We will talk about bad breath. It is called also halitosis. It affects around 50% of world population, so it's extremely common condition, and in most cases it's not caused by disease. The major cause of bad breath is poor oral hygiene. Around 60% of cases of bad breath is caused by poor oral hygiene. The idea of poor oral hygiene is that food particles stay in between the teeth and on the gums, and they rot, and bacteria are growing, and bacteria releasing different gases, and these gases are foul smelling, and person has bad breath. And here is question what we can do to avoid and what is most evidenced best practice for dental hygiene. First and most important is brushing your teeth twice a day, one in the morning, second at night before sleep. Each session of brushing your teeth should be at least 2 minutes. Use a soft bristled toothbrush and use fluoride containing toothpaste, and flossing your teeth once a day is recommended. Also, flossing will help your teeth to remove food particles from between your teeth, and it's also effective method. So brushing your teeth twice a day and flossing once a day, it's considered best practice of good oral hygiene. Second most common cause of bad breath is periodontal disease. Periodontal disease means inflammation and infection of gums and teeth. Around the teeth, there is buildup of plaque, which consists of bacteria and different particles, and it's also foul smelling, and there is bacterial inflammation and infection of gums, which eventually causes tooth loss. That's why periodontal disease is serious condition, and you should pay attention. It causes not only bad breath but also causes tooth loss eventually, and also it causes gum bleeding, which is not favorable condition of course, and eventual tooth loss. It's responsible around 20% of cases of bad breath. And what we can do, what is best practice to avoid or to minimize periodontal disease? Best method of treatment is scaling and root planing. Scaling and root planing helps to remove this bacterial growth and particles from teeth, and it improves gum condition, and also we need antibacterial treatment in this case, and classical gold standard of antibacterial mouthwash is chlorhexidine. Use of chlorhexidine is effective because it's effective against many types, wide range types of bacteria, and best practice here is 2 tablespoons rinse chlorhexidine around 50 milliliters. It's 2 tablespoons twice a day, and for 30 seconds. Don't eat or don't drink after rinsing chlorhexidine around 30 minutes for its best effect, and you can do this for 2 weeks. After 2 weeks it can have some side effects, so it's not favorable and it's not advised to use. Sometimes it is recommended for months, but usually optimal duration of treatment with chlorhexidine is rinse 2 times a day for 2 weeks. Also, third most common cause of bad breath is dry mouth. Dry mouth accounts around 15% of bad breath. And why dry mouth happens? Most commonly, people who breathing via mouth and don't breathe via nose, they have dry mouth and they have bad breath. What's the idea? Idea is that saliva washing out bacteria, and saliva also neutralize acid environment and acids which are produced by bacteria and which have foul smelling, and that's why dry mouth causes bad breath. So hydration is important. Best way of hydration is drinking water. Reduce caffeine is important because caffeine and alcohol can cause dehydration, and xylitol containing chewing gums also important because they have antibacterial action and also stimulate saliva production. Also, tobacco usage can cause bad breath, garlic, onion and spices, some spices. So different types of foods also causes bad breath. And when disease cause bad breath, the most common diseases are gastroesophageal reflux disease. You can guess that it's gastroesophageal reflux disease when person says that he has heartburn after eating, and especially at night. And second is postnasal drip syndrome. It means that a person will say that he always have feeling that mucus in their throat, and they always want and have feeling that they need to clear their throat from mucus. And this condition is commonly associated with sinusitis. So if person has sinusitis, there is higher chance that he or she can have postnasal drip and it causes bad breath. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.